go. Man, I'm so psyched about this, but I can't understand why nobody else wants to come out to this ADN cheer squad.
You must be studying more than us or something. I don't know.
I guess that's why, you know, we're such better students, well-rounded and everything.
Yes. Why don't you show me that new routine, though, and maybe people walking by will see it and they'll come out and try out, okay?
I agree.
I want to see it. You got it.
Well, here, hold this for me.
Okay.
I think you're going to like this because it incorporates a lot of what we've learned this year already.
Yeah. Okay, good.
And
good.
my goal is I'm going to finish it off with a nice little cartwheel.
Okay, good. I love
All right. Ready? Okay. Cardiac, pulmonary, renal 2. I hope my liver can make it through. ADN, 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 yeah.
Yeah.
I'm gonna do a flip.
Ted, are you okay? Are you okay? Ted. Okay, I gotta call 911. Ted, wake up. Ted, are you okay? Yeah, my friend just fell at cheerleading practice and he's not awake and I think he broke his arm. Please come quick. Ted!
Oh, okay. Oh, did I land it? Oh man.
Ted, you okay?
Hey,
Ted.
Katie. Hey, my arm is really hurting me. Why am I in sim lab?
Ted, are you okay? Do you know what day it is? We were practicing our routine and you fell and hit your head. Do you know what's going on?
No, the last thing I remember was that nursing final, and I'm hoping I blacked out because I passed and was celebrating.
All right, Ted, you're scaring me. I'm gonna go get the nurse.
All right, Katie. I remember I was doing that routine and tried to do that flip. I guess I didn't make it.
Don't you dare do that to me, okay? You know I was on the neuro floor last semester and I saw all kinds of bad stuff. Don't you do that.
I know. I'm sorry, Katie. Hey, look, I was just trying to cheer you up, and do you think that they're going to let me out of this cardiac test, seeing how I'm in such a fragile state?
Well, I don't know about that, but let's not worry about that right now, okay? Hey, Nick, I guess? Ted, I guess this is your nurse, Nick.
Oh, Nikki, you're so fine, you blow my mind. Nikki? Hey, all right, hey, look, sorry about that. Hey, we're nursing students. You got any tips for us? We have a big cardiac test coming up.
Yeah, we can talk about that later. I've got 3 Q2 neuro checks due 2 hours ago. You know how it goes.
Yeah.
All right, let's get this over with. Can you squeeze my hand? Okay, press your feet against my hands.
Okay.
Cool, are you in any pain right now?
Yeah, I'm in a fair amount of pain. I'd say I'm about a 7 out of 10, and I'm trying to decide whether it's stabbing or burning, and there's maybe a tiny bit of tingling too.
All right, enough of the nursing student talk. Good for you throwing your pain words around. Looks like you got some oxy ordered. I'll go get those for you and I'll be back in a second.
Okay. Hey.
Yeah, I heard you. Someone will be there in a second to get you off the bedpan. Can I for once get a 20-year-old female patient instead of someone's grandma? Am I right? So look, you had some pain, right? What is it on a scale of 1 to 10?
Well, an hour ago it was a 7 out of 10. Now I think I'm about a 9 out of 10, and it's really starting to get tight. Can I get you to check it, please?
Look, dude, you broke your arm 4 hours ago. You also hit your head. Now you're here on the neuro floor. A little pain can be expected. But you take this oxy, order some lunch, and watch some TV. Oh, and another thing. Quit talking about the cardiac test. I got PTSD after that last year. I can't take any more stress on this shift.
What? Excuse me? Did you really say that?
Katie, just let him go. I mean, he's apparently having a bad day, and...
Ted, that guy is rude. I feel very unsafe with you being here and him being your nurse.
Yeah, I know he's being pretty much a jerk about things, and, you know, maybe he's a little right. It's the first time I've broken my arm like this, and, you know...
No, Ted. We cannot let him treat you this way. This is not fair and it is not safe, okay?
I tell you what, if the night nurse comes on sometime within the next hour, right, if things don't change, you know, we'll get the charge nurse and talk to her.
All right, it's your arm and it's your pain, but I don't think it's right. So let's order you some food and you can relax, and I'm gonna see if I can order you some prune juice since our wonderful nurse, Nick, did not offer you any stool softeners for those opioids.
All right, thanks, Mom.
All right. Don't make me take this wrath out on you, Ted.
I'm Abraham Lincoln.
Hey Nick, how's it going?
You know, I could tell you, but it really doesn't matter. What does matter is that I'm out of here for the next glorious 4 days.
Sounds nice. So tell me about what's going on in room 402.
All right, well, Mr. G, he's a 30-year-old male admitted for supervision of post-head trauma. This guy decided it'd be a good idea to do a cartwheel or front flip or something. I don't really know. He fell, he hit his head, and fractured his distal radius and ulna in his right arm. ED saw him first and went ahead and casted him. I'm assuming he'll go home in the morning after he checks out with the neurologist.
All right, so what are we actually doing for him?
Well, he's due for a neuro check. He's Q2. Last time I saw him around 5, I gave him some oxy and told him to order dinner. His pain was a 6 or a 7, I can't remember. We got that lady in 406 again, and she had me in there every 15 minutes. So really, this guy is at the bottom of my priority list. Oh, and just a heads up, he's a nursing student, so be prepared.
Gotcha. So we're doing some pain management, neuro checks. Did you have a chance to reassess his pain after you gave him that oxy?
Like I said, I've had a lot going on. We'll check on it when I go in there to introduce you.
Okay.
All right, kiddos, I'm out of here.
Hey y'all, I'm Paige. I'm taking over for Nick.
Hey, Paige. I'm Katie. I'm Ted's friend. I was with him when he fell.
How long has he been sleeping?
He's been sleeping for about 45 minutes. He ate dinner and took those pain meds, and he's pretty much been out since then. I don't think he's taken a lot of these pain meds in his life, so I think he's just kind of out. What's that called? Opioid naive?
Yeah, that's it. Are you in nursing school too with Ted?
I am. Oh, I'm sorry. I forgot y'all don't like to talk about nursing school stuff. I'm sorry.
It's fine. I'm sure it's probably all that you can think about. Don't worry about it. I'm just gonna get a set of vitals on him really quick, okay?
Okay, sure.
All right, well, it looks like you're all settled in here. Paige, I'm out.
Bye, Nick. Have a good day off.
Bye, Nick.
He's gone. Paige, right?
Yeah, I'm Paige.
That guy was horrible.
It sounds like you are upset. You want to talk about that some more?
Yeah, I'm a little upset. I just don't, he wasn't listening to me, and I feel like I'm not being heard right now, and I'm starting to get concerned about my arm.
Okay, absolutely. I'm really sorry that happened. I'm here now. I'm gonna grab some vitals on you. I'm gonna take a look at your arm, okay?
Okay, thank you.
You're welcome.
Hey, Katie,
Sure, Teddy Bear. What's up?
will you get me some more ice water, please?
Anything for you, Roosevelt.
Thank you. Hey, Paige. Look, I didn't want to say anything while Katie was still in the room. You know, she's pretty concerned as it is, but I'm definitely getting very concerned about my arm. It's getting tight. I feel like I'm the Incredible Hulk getting ready to bust out of his clothes. I've been trying to wiggle my fingers a little bit to make sure I've got some blood flow. I've got some tingling up and down the arm, and like I said, I'm really starting to get concerned.
Absolutely, Mr. G. It's okay. Like I said, I'm here now. Talk to me some more about this pain. I hear you said you're in a lot of pain right now. Talk to me a little bit more about what's going on.
Like I said, basically, I would say like an 11 out of a 10. I know I used to hate it when people said that, but I usually don't complain about pain at all. And he gave me the medication. It just took the edge off of it. And like I said, I'm really starting to get pretty scared about what's happening.
Okay, absolutely. I'm gonna grab your vital signs. I'm gonna do something called cap refill on your fingers. I'm just gonna see how quickly the blood returns back. All right, let me feel your pulse over here. All right, Mr. G, your arm is really red and swollen. You're having that pain and that tingling. I believe that you're experiencing something called acute compartment syndrome. This is what happens when your muscle fibers need space to expand, but the compartment that they're in won't allow them to do that. So the blood vessels in your arm are being compressed. That explains the tingling, okay?
Okay.
I'm gonna call Dr. Starnes. I'm gonna let her know what's going on. I'll be back in just a minute, but can I get you anything?
No, Paige, I appreciate you taking care of me here.
Absolutely. I'm gonna go call her and I'll be back, okay?
Okay.
Hello?
Hey, Dr. Starnes. This is Nurse Paige calling from the neuro floor at New Hanover. I've got one of your patients, Mr. G. He was admitted to us this afternoon from the ED after he fell, hit his head, and broke his arm. He has a cast on his right arm, and he's currently complaining of pain out of 11 out of 10 in the casted arm. He's got a lot of tingling and some numbness also. It's very swollen and it's very red. His cap refill is very, very sluggish, and I think it looks like he might have acute compartment syndrome. I recommend that we remove the cast immediately. Can you come and come assess his arm?
Oh, I was just on my way out of the hospital, but you know what? It's okay. It'll only take a sec. I'll head that way now. Tell him I'm on my way. Thanks.
Great. Thank you, doctor.
Hmm?
Hey, Mr. G.
Hey, Paige.
I just got off the phone with Dr. Starnes. She's going to be up in just a minute to take a look at your arm and see what she wants to do, okay?
Okay.
Can I get y'all anything? She should be here in just a minute.
No, I just appreciate all your help so far.
Yeah,
Thanks,
absolutely.
Paige.
You're welcome. We'll be back in just a minute,
Thank
okay?
you.
You're welcome.
She's much better.
Yeah, I would say.
Hey, Ted. Okay, so we've got your results back, and it appears your intracompartmental pressure was 31 millimeters of mercury, which does in fact mean that it's compartment syndrome.
Okay.
So what we're gonna do is we're gonna take you down for a surgery called a fasciotomy. We're gonna open up the arm and release the pressure from within and let the muscles expand some. Okay?
All right, so the fasciotomy, that's the surgery. There's no other option? Anything else?
Unfortunately, there's not. In fact, not only is it the only treatment, but we need to do it as soon as possible in order to get the best results.
Okay, Doc, let's go ahead and make it happen then.
Okay, you sit tight. We'll be in soon to prep you, okay?
All right, thank you.
Ted, you look a little bit concerned. Do you have any questions about the procedure?
I'm just, Paige, I'm just really nervous. I cannot believe that this is really happening here today.
I hear you, and I'm really sorry that everything's happened up to this point. Dr. Starnes is a great surgeon, and she's done this procedure many times. You're in great hands with her. We're going to do everything that we can to get your arm back to normal, okay?
Okay, thank you, Paige.
You're welcome. I've got some paperwork here to get your consent for the surgery, and we're going to go through everything together. So if you have any questions along the way, just stop me and we'll talk about it, okay?
Okay.
All right.
All right. Good thing I'm left-handed.
Hey there, Ted.
Hey, Doc.
Ooh,
How are
that
you?
hand's looking good.
Thank
Let's
you.
see.
Thank you.
How's it feeling?
It's doing very well.
Yeah?
Much
Okay.
better.
It looks good. Incision's healing nicely. How's it feel?
It feels good. The pain is a lot lower than it used to be, and I've got a pretty good amount of motion in it.
Good. Okay, so let me see. Can you make fists with both your hands?
Yes.
Excellent. Okay. How about straighten them out? Wiggle all of them? Not so coordinated, but looking good. Okay, let me check your pulses real quick. Good and equal. How about some cap refill? Just checking to make sure you've got really good blood flow to your fingers.
Okay.
You do. They're nice and warm. Doesn't feel too hot. You've not had any feelings of a fever or anything like that?
No fever? No.
Excellent.
Feeling good.
And it's full range. You feel like you can use it for everything you used to?
Yeah, I'm still a little careful with it, but yeah,
Sure.
pretty much, daily use is good.
Any pain still? Scale of 0 to 10?
I'd say maybe a 1.
Okay. Well, that is doable, and it should get better. You can exercise it around an exercise ball some and get a little bit of strength built back into it. It should help.
Okay.
Well, you look great. Well, hopefully I won't have to see you again in this circumstance.
Alrighty. Well, thank you, Doctor. I appreciate all your help, and definitely Paige. I think I would credit her with really making sure that my arm was saved here.
Absolutely. She's a good nurse.
Yes. If you see her, tell her I said thanks.
I will. See you later.
Bye.
Oh, Mickey, you're so fine, you blow